Folks, Nick the Nurse here. Today we're going to be talking about some of the signs and symptoms associated with the nursing problem of pericarditis. Let's get started. Some of the signs and symptoms of the nursing problem pericarditis that might show up on nursing school exams or possibly even on the NCLEX exam include a sharp pain over the sternum, right, your breastbone here, which may radiate to the back, arms, shoulder, or neck. You might have pain on inspiration, right, when you're breathing in, fever, chills, dyspnea. You might have a dry cough, a pericardial friction rub. That's big. We'll come back to that in a minute. Tachycardia, fatigue, swelling in the legs or abdomen, orthopnea. What's orthopnea? As a good astute nursing student, you know that orthopnea is difficulty breathing when lying down. Elevated WBC count, right, due to infection or due, again, to inflammation. Let's go back a minute, though, because one thing I would caution you to watch out for as a major sign or symptom when you're talking about pericarditis on nursing school exams or maybe even on the NCLEX is that pericardial friction rub, right? You have the pericardium and you have that rub sound, okay? So when you auscultate the heart, you might hear that pericardial friction rub. It's kind of faint, but you can I've heard it before. You can hear that in patients. How do you know if you have a pericardial friction rub? This is an assessment, just kind of not going too much off topic. But when you have a pericardial friction rub, how in your assessment can you tell if you're listening to a pericardial friction rub or if it's a pleural friction rub? How do you know the difference? How do you differentiate? Well, the answer is that if you ask the patient to hold their breath, and when they're holding your breath you don't hear that rub anymore, chances are if there is a rub it might be a cardiac friction rub, or in this case a pericardial friction rub, because the heart doesn't stop beating at first when you hold your breath. However, your lungs stop rubbing together, okay, up against the pleural sac. So that's just something you might want to keep in mind for your assessment in your clinical and in your theory when studying for nursing school exams or for the NCLEX. Again, my name is Nick the Nurse. I want to thank you for watching my video today. You can check out any of my other free videos, all of them completely free, at www.nickthenurse.com. Again, www.nickthenurse.com. I want to thank you for watching my video today, and we'll see you next time.